Hello, and thank you for viewing our webinar that we have put together from the AGC of Wisconsin. We've been receiving a fair amount of calls at the office in regards to this topic, so we thought it would be best to put together a short program featuring some tips and guidelines of how to deal with a potential or confirmed COVID-19 case on your job site. So with us today, we have our three in-house experts. Derek Allen, our General Counsel at AGC of Wisconsin, Jim Falbo, Associate Director of Safety and Workforce Development, and also Brent Miller, Director of Safety. So we will plan on covering three primary topics here. We'll review the flow chart if you have a suspected and or confirmed COVID-19 case on the job site. We'll also review the employer's response plan. And then lastly, Derek will cover the legal aspects of a suspected and or confirmed case on your job site. So go ahead and get started with Brent Miller. Go ahead, Brent.
Thank you. First thing we're going to go through on the flow chart is a step-by-step process procedure for employee or employee close contact to someone either being tested or suspected of the COVID-19. With that, I just want to remind everybody that you should contact your local county health department if there is a suspected COVID-19 or a confirmed case of the COVID-19 on your job site. So first, we're going to go through the flow chart. We're going to move slowly through it. If you do have any questions on this flow chart, please contact the AGC office, Jim Falbo or Brent Miller on this one. So employee consults with the supervisor. If the employee in typical situation where your employee comes to the job site, either you're doing pre-scanning or that employee gets sick on the job during the work day, you would kind of follow through this flow chart here. So first thing is, employee has tested positive for the COVID-19 and directed to self-care at home. If that is yes, then the employee should self-quarantine and self-monitor for at least 10 days since symptoms first began, and 3 days or 72 hours after symptoms resolve without the use of any type of fever-reducing medicine. Next box below that, no, if the employee did not test positive. The employee had close contact with someone who has tested positive for the COVID-19. Close contact, depending on the county, could be either a 5-minute, 10-minute, or 15-minute close contact. So again, you would check with your county health department on that. If you have an employee that has worked close to an employee that has tested positive, that employee should practice self-quarantine, self-monitor for 14 days from the date of last contact. Take temperature twice a day. The employee should take the temperature twice a day. Watch for cold and difficult breathing. Contact your doctor if health changes on that. Box below that, employee is undergoing testing for COVID-19 and awaiting results. Typical results right now are 24-hour turnaround. So that's pretty quick compared to it was 5 to 7 days when it first started here. For a positive test results, employees should self-quarantine and self-monitor for 10 days since symptoms first began, or that 72 hours have passed since recovery, defined as resolution of fever without the use of fever-reducing medicine. Next box below that, close contact for employees that is undergoing testing for COVID-19 and awaiting test results. Again, close contact, depending on where you're at, could be the 5, 10, or 15-minute close contact requirement there. If employee tests positive, close contact should self-quarantine, self-monitor for 14 days from the date of last contact. Employees should take their temperature twice a day and watch for the cough or difficult breathing. If you do have a cough or difficult breathing, contact your doctor for any of the health changes there. If the employee's test is negative, for the close contact may return to work. Okay, that's what we want. We want everybody to return to work here. Employees is next box. Employee is responsible for providing care for a person who has tested positive for the COVID-19. If your employees do have someone at home that they have to take care of that has tested for positive, that would be considered a close contact, of course. The employee should practice self-quarantine, self-monitoring 14 days from the day of last contact, take temperature twice a day, watch for the cough, difficult breathing, contact your doctor or health if the health changes there. Employee has symptoms of COVID-19, fever, cough, shortness of breath, any symptoms from the CDC website. But our symptoms are not severe enough to seek treatment. The employee should self-quarantine. To be released from self-quarantine, the employee should have at least 72 hours without any type of fever, without using the fever-reducing medicine there. And at least 10 days have passed since the last symptoms have passed, that an employee would follow there. Last one, or second to last one there. Employees should, or employees close contact has symptoms of COVID-19, fever, cough, shortness of breath. Again, following the CDC requirements, the employer should practice self-quarantine, self-monitoring for 14 days from the date of last contact, take temperature twice per day, watch for the cough or difficult breathing, contact your doctor if the health changes there. Now, again, this is an updated flow chart. It could change tomorrow, it could change in 2 weeks. So go to our website, the AGC of Wisconsin website, and look at the updated flow chart if needed. Next, I'm going to pass this off to Jim Felbo, who's going to go through the employer's response plan. Jim, take it away.
Thanks, Brent. So if we do have a positive test result from an employee on a job site, if the person is on your job site, we need to get that person off the job site as soon as possible. If they do come to the job site and they have a temperature or are not feeling well, have any of the symptoms of COVID-19, they should be removed from the job site as soon as possible and isolated. Before they, if they have left, or if they are still at the job site, or if they haven't even, they should not come to the job site if they're not feeling well. We need to try to start contact tracing for this employee. So if they were on the job site the day before and they feel sick the next day, we need to know for the last 3 days where this person worked and who this individual had close contact with. Close contact, as Brent stated earlier, can be anywhere between 5 to 15 minutes, and it's going to be within the 6 foot social distancing requirement. If anybody falls inside that, then they want to know who those people are so that we can then look to isolate those employees as well. Also, with that, suspected cases that potentially can be confirmed, again, obviously send those people home as soon as possible. After the next bullet point that we have there is I have added communication. Now, Brent and I have been talking to several contractors about how they have handled some potential and positive COVID-19 cases. And the one thing that has come up every single time is communication to all of the employees and the site partners is one of the utmost important things, is to be as transparent as possible, to tell them that they do have a positive on site, to try to contact trace as soon as possible. But also when we talk about contacting employees, it's the employees on the site. But when you're talking about your site partners, if you're the general, it's your subcontractors. If you're a subcontractor, it's the general contractor. Making sure that their leadership team knows that you have had a positive. We've had several cases where positive test results have come across a contractor's had a positive test for a contractor, and they did not tell their partners until 5-6 days later, which makes contact tracing a lot more difficult. So that communication is important with everybody on the site and the site partners leadership team. Also, one thing we need to do is contact your local health department. Like Brent mentioned earlier, our local health departments have different rules for contact tracing. The local health department is the one that's going to be responsible for contacting employees and contacting close contacts for the contact trace. So please make sure that the local health department is contacted. After that, we have to be able to make sure that a medical evaluation is completed. Make sure that employee is seen by a doctor, and if he needs to have a COVID-19 test, if he hasn't already been tested, that is completed. Also, then we have to investigate, because COVID-19 also can be a reportable injury, reportable illness on your OSHA 300 log. So you're going to have to investigate that to see if the illness was acquired while he was working. If it wasn't acquired while he was working, then it's not necessarily considered a reportable injury. But still, all of the requirements for being reportable are still possibly can take place. So making sure that if it is recordable, you do record that case in your OSHA 300 log. Also, after we do have a positive case, we have to identify some corrective actions, such as where did this employee work? We have to be able to decontaminate the job site. So we have to, usually what the CDC guidelines are telling us is that once a positive is known, that we clear the area where that employee was working, and we wait 24 hours, and then we completely decontaminate the area where that employee was working with sanitizing solution. And then lastly, we should establish some follow-up procedures. Always want to stay in contact with the affected individual that has that contracted COVID-19 to make sure that we understand what his status is. Also, if we have any isolated employees, we should be contacting them as well to make sure that they understand the procedures that are going to be taking place and things and what is expected of them. And just what Brent mentioned earlier on the when he was talking about the self-isolation, that they understand what they're supposed to be doing during self-isolation and how they're supposed to be able to protect themselves and others while they are self-isolating. So that's pretty much what should be done if you do have a COVID-19 positive test result or potential positive test result on your job site, to try to stem that the spread of the virus on your job site. So what we want to do now is we want to have Derek Allen, our legal counsel, wants to go over just a few things that contractors have to watch out for if you do have a suspected or confirmed case of COVID-19. Derek, I'll let you take it away.
Thanks, Jim. 3 areas to keep an eye on when you do get a COVID-19 or suspected COVID-19 person on your site. The first one is to make sure you're following current CDC and Department of Health guidelines. The reason for that is there are things that follow those guidelines now that would not have been legal or advisable pre-COVID-19. Big example would have been taking temperature. If someone would have called me last summer and asked if they could take their employee's temperature, I would have told them no. That's a medical exam that you as an employer are not able to do. But you can now because of COVID-19 and CDC guidelines. And there is a safe harbor. The regulators have come out and said, if you're following CDC and Department of Health guidelines, that is a safe harbor from other laws that you would otherwise be violating with what you're doing. But the key factor is it's got to be current. So if you sort of look at it one day and then you don't look at the guidelines for 2 weeks and you do something that was okay 2 weeks ago, but has since changed under CDC guidelines, you might not be eligible for that safe harbor. So make sure you're up to date. And if you're following those guidelines, you can be sure that you're going to be immune from, ADA lawsuits, employment law lawsuits, those sort of things. So just make sure you're following current CDC and health guidelines. Second one, and candidly, I think this is probably the biggest risk that's out there when COVID-19 lawsuits start heating up in the next 6 months to a year or two, is the confidentiality of people that contract it. So what's important there is you should not identify specifically a person. So you don't want to send out an email to everyone that's been on the job site and say, so-and-so had COVID-19. If you're in contact with them, here's what you need to do. Okay. If you've done that, you violated the ADA by basically broadcasting someone's confidential medical information. Another tricky aspect is you can't say a plumber might have been in touch with, a plumber had COVID-19 and he was on the job site. If there was only one plumber, well, you've identified him. You didn't say his name, but you've identified him. So that's another place to be careful about that. Third important thing with that is an employee themselves can broadcast whatever they want. You don't want to be caught encouraging them to let people know, but if they, especially with COVID-19, in my experience, some people they don't care if other people know. They actually want other people to know that it was them, so that they can keep other people safe. If an employee does that on their own, that's fine. We're all allowed to broadcast our own medical issues as much as we want. Again, don't encourage them to do it, but if they do it on their own, there's no employer liability for that. Third issue would be determine their eligibility for sick pay. Under the Families First Coronavirus Response Act, or FCRA, employees that are either sick themselves or under a quarantine order because they're in contact with someone that was sick are eligible for up to 2 weeks of pay. The important thing there is there needs to be a documentation component. So you can't, following the good advice that Brent and Jim gave, send someone home for 2 weeks and then they come back, and if they didn't talk to a doctor and they don't have any documentation, they're not going to be eligible for sick pay. And if you paid them sick pay, you're not going to be eligible for reimbursement. So what you need to do is have those people, once they're sent home, reach out to their doctor and basically explain the situation. Their doctor will provide some type of note. The versions I've seen are come get tested, or it's not that bad for you, but you might have it, so just stay home. And then they'll give some sort of guidelines as far as how many days you have to be symptom free. They'll give a checklist, and then once the employee passes those, then they can come back to work. Or this doesn't sound like COVID-19 at all. We feel good about it. You can go back to work right away. Whatever the doctor's note says, just make sure you follow that. But what's really important for the sick pay part of it is there need to be some sort of documentation. So when you send that employee home, when you send the other employees that are in contact with that person home, tell them to reach out to their doctor, explain the situation, get information from the doctor, and then that covers you from liability, because from that point on, you can say, I was following medical professional advice. And number two, it's a requirement to get reimbursed for any sick pay that you give that person.
Okay, so thanks, Derek, Jim, and Brent. So if you have any more questions, looking for specific details in regards to what's going on your job site as it relates to a suspected or confirmed case, you'll see Derek and Jim and Brent's contact information